Hello everyone, we are Group 4 and we are here to present a small video of mental health issues behind bars. So let's take a look of the video to find out what can help us to learn about the mental health issues of incarcerated populations behind bars.
Number three!
This is what checking into America's largest mental health institution looks like. It's not its official role, but when 30% of people being shuttled around from cell to cell and locked away in this jail are thought to have psychiatric problems, that by default is what it's become.
Okay, Robert, here we go.
We watched as this man was processed into the jail, having his mugshots taken. He was charged with criminal trespass, sleeping on someone else's property. 42-year-old Robert is homeless and he has schizophrenia. We saw as he shuffled off into what is a tough world. In parts of the jail, up to 400 inmates are kept in a single room where they eat, sleep and live all together. But the number of those among the prison population with mental health problems appears to be ever increasing. It's now thought there are more than 3 times the number of psychiatric patients incarcerated in America than are in hospitals.
Good time. Come on out, please. Say your name.
There are some areas of the jail that do have the look of a treatment center. Those running this facility have at least recognized that mental health provision needs to be a huge part of what they do. The new warden of the jail is even a psychologist. But what they can't change is a system that means so many people who should be treated in the community end up in a place like this.
You have people who are sick, not criminals, they're sick. No different than if they had diabetes, but they have a mental illness. It's not being treated. Why is it not being treated? Well, guess what? States throughout the country, throughout the United States, have decimated the mental health programs. So there are none. People scramble to find anything. So where do these people end up then en masse? In the jails and prisons. And it's been going on now for decades.
There does seem to be recognition that too many people in America are going to jail, particularly those with psychiatric problems. That can only be resolved with fundamental changes in the justice system here and improved mental health provision outside prison. But both those things feel a long way off. Aleem Maqbool, BBC News in Chicago.
Here are key facts and status quo of mental health issues of incarcerated populations. Around 450 million people worldwide suffer from mental or behavioral disorders, and these disorders are more prevalent in prison populations. Most persons in correctional facilities have mental disorders as defined by the Diagnostic and Statistical Manual of Mental Disorders. Almost 50% of individuals incarcerated in prison demonstrate antisocial personality disorder. About 26% of inmates were diagnosed with mental health condition, only about 18% taking medication on admission in prison, and more than 50% medicated for mental health conditions at admission did not receive pharmacotherapy. Hello everyone, my name is Joy. From this point, our group would like to begin introducing to you the definition of mental health. According to World Health Organization 2018, mental health is defined as a state of well-being in which the individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her own community. Mental disorder occur in high rates in all countries of the world. Brief hospital stay and inadequate community resources have resulted in an increased number of persons with serious mental illness living on the streets or in jail, according to Stanhope and Lancaster 2011. In this slide, I'm going to discuss the challenges for prisoners with mental issues. Prison is a stressful experience, and prison is basically stressful environments. There are studies showing challenges by prison inmates in the correctional. According to the World Health Organization, They identifies 5 challenges for prisoners with mental issues. First, mental disorder occur at high rates in all countries of the world. There are several factors that related to this one. Widespread misconception that all individuals with mental disorders are a danger to the public. The general intolerance of many societies to the disturbing behavior. Failure to promote treatment, care, and rehabilitation. Persons with mental issues in the criminal justice system are sometimes the most marginalized and undeserved patients in need of mental health care. Lack of or poor access to mental health services. Prisons with mental health issues have poor access to mental health services more likely than the other prisoners because sometimes they held in solitary confinement because of their destructive behavior. Next challenge for prisoners with mental issues is prisons are bad for mental health. There is an increased risk of suicide in prison. There are factors that strongly related to prison suicide are overcrowding, various forms of violence, enforced solitude, and lack of privacy. Overcrowding is one of the key contributing factors to poor prison conditions around the world. Arguably, also the biggest single problem facing prison system, and its consequences result to worse be life-threatening. In this slide, other factors that related to prison suicide are lack of privacy can also cause or exacerbate mental health problem, lack of meaningful activity, isolation from social networks because prisoners they have no opportunity for personal development, insecurity about future prospects like works and relationships. Last is inadequate mental health services. This is because the attention given to mental health is very low across the globe in general. For prisoners in particular, especially the low-income countries. Also in the slides, another 3 challenges for prisoners with mental issues identified by the World Health Organizations are prisoners are sometimes used as a dumping grounds for people with mental disorders. According to several studies, prisons referred as dumping grounds for people with mental disorders because studies have found the link between mental health and crime. They are more likely to experience mental health issues compared to the general population. Fourth, people with mental disorders are exposed to stigma and discrimination. Fifth, effective treatment is possible, but too often the available resources are wasted. This shows that there is a high demand for mental health services. This is sometimes resulted to backlog in the prison system. It shows that the growing number of inmates, they never get the help they need.
Hi everyone, I'm Feng Shen. I'm going to talk about the health and service access challenges for correctional offenders with mental health in transition from incarceration to community by Correctional Services Canada and the benefits of responding to mental health issues in prisons. The literature reviewed by Correctional Services Canada investigated the challenges and outcomes for offenders with mental health issues during transition from incarceration to the community. And the contributing factors to these challenges and outcomes include individual factors, structural factors, and system factors. The individual factors contributed to a heightened difficulty to remain engaged in treatment services. There are certain structural factors like restrictive housing and employment policies or requirements posted barriers that did not accommodate the specific needs of mentally ill inmate populations. System factors. Inadequate pre-release planning and unstable housing were obstacles to attaining social stability and engaging in treatment during the transition from incarceration to community. The Correctional Services Canada also did an evaluation of interventions or approaches for mitigating these harms over the last 20 years. According to Correctional Services Canada, in custody treatment with both pre- and post-release care planning, arrangement, and follow-up are most consistently beneficial. Offenders engaged in post-release mental health treatment experienced lower rates of hospitalization, death, and reincarceration. Continuity of treatment for offenders with mental disorder post-release is important to improve outcomes, but is jeopardized when other pressing social needs such as housing, employment are prioritized. The stresses that contributed to poorer outcomes were lack of social support and the challenges in obtaining financial and housing stability during reintegration. Here are the benefits of responding to mental health issues in prisons for prisoners, for prison employees, and for the community. Addressing mental health needs will improve the health and quality of life of both prisoners with mental disorders and of the prison population as a whole. By promoting the greater understanding of the problems faced by those with mental disorder, stigma and discriminations can be reduced. Ultimately, addressing the needs of people with mental disorders improves the probability that upon leaving prison, they will be able to adjust to community life, which may in turn reduce the likelihood that they will return to prison. For prison employees, a prison that is responsive to and promotes the mental health of prisoners is more likely to be a workplace that promotes the overall morale and mental health of prison staff and should therefore be one of the central objectives of good prison management. There are also a lot of benefits of responding to mental health issues in prisons for the community. Since there is a constant interchange between the prison and the broader community, through constant admission and release of prisoners, prison health must be seen as part of public health. Addressing the mental health needs of prisoners can decrease the incidence of reoffending, reduce the number of people who return to prison, help divert people with mental disorders away from prison into treatment and rehabilitation, and ultimately reduce the high cost of prisons.
Hi everyone, myself Marina. Today I would like to talk about mental health strategy for corrections in Canada. According to Correctional Services of Canada 2009, the mental health strategy for corrections in Canada is comprised of two parts: the framework and the strategic priorities. The framework for the mental health strategy for corrections in Canada consists with the goals and principles outlined in the 2006 United Nations Conventions, the right of persons with disabilities in particular to ensure and promote the full realization of all human rights and fundamental freedoms for all persons with disabilities without discrimination of any kind of the basis of disability, which would also extend to individuals within the care, custody, or correctional system. The framework, it explains that when individuals with mental health problems or mental illness are involved with the correctional system, an emphasis is placed on providing an opportunity to engage these individuals to ensure community established treatment plans, to develop and implement new treatment plans, and to integrate the mental health services received in correctional setting with community-based treatment and follow-up services. Moving to the key elements and expected outcomes for an effective continuum of care, where within the correctional system, mental health promotion, screening and assessment, treatment, services and support, suicide and self-injury prevention and management, transitional services and support, staff education, training and support, and community support and partnership. Next is the strategic priorities. In the strategic priorities, it identifies the priority areas for work over the next 5 years in order to improve all performance against the key elements outlined in the part 1. The strategic priorities were knowledge generation and sharing, second, the enhanced service and delivery, third, improved human resource and management, the fourth one, building community supports and partnership. In knowledge generation and sharing, this leads to effectiveness in the other areas of this strategy, specifically enhancement of service delivery, improved human resource management, and building community supports and partnership. Second, the enhanced service delivery. It refers to the activities throughout the continuum of care including screening and assessment, treatment, support and services, suicide and self-injury prevention and management, transitional services and supports, and community supports and partnership. Third, improved human resource management. This refers to the ongoing support, education, and training in mental health to enhance staff well-being and the knowledge and skills to interact effectively with individuals with mental health problems and or mental illness. Lastly, building community supports and partnership. This refers to the activities that supports a seamless continuum of care through building relationship with partners to optimize individual mental health and well-being while contributing to the shared responsibility of public safety as mentioned in Correctional Services of Canada 2009. Thank you.
Hello everyone, my name is Suhangi. I would like to present here the role and responsibilities of Canada's healthcare system. Canada's healthcare system is divided into two parts, federal government and the provincial government. Federal government provides the funding to the government of a provincial government, and the provincial governments provide services, organization and management to the residents. As per the Correctional Services Canada, the legislative mandate for incarcerated group healthcare comes from our Correctional and Conditional Release Act. Here is the role of Standing Senate Committee. The Standing Senate Committee made an action plan including the analysis and recommendations by the stakeholders. The stakeholders also used a strategy with evidence-based practice, and the outcomes were including the assessment of the mental health care needs of inmates more rapidly, providing care more quickly, reducing the rates of segregation, lowering the rate of violence and self-harm as well as the suicide, better access to rehabilitation programs, and a better integration with local community mental health resources at the times of release. Hello everyone, here are the role and responsibilities of community healthcare nurses. Community healthcare nurses should divert the people with mental disorders towards the mental healthcare system so that they can get the enough and proper treatment for their mental healthcare disease. Provide prisoners with access to appropriate mental health care treatment as well as the care. The mental health treatment like antipsychotic medications and other psychological treatments should be available and accessible for the people with incarcerated population. Provide access to acute mental health care in psychiatric wards of the general hospital. In the case of an emergency in acute care, services should be available for the people with incarcerated population with the mental health care disease. Ensure the availability of psychosocial and rationally prescribed psychotropic medications. The prescription by the doctor should be available for the people with mental health care disease, as well as the medications like antipsychotic medications should be available for the people with mental health care in the incarcerated group. And these people should be and this should be provided with with the other treatments like ECT and other psychotropic medications should be available for these people. Provide training to the staff to provide unnecessary to avoid unnecessary hassle and unnecessary torturing to the people. The education should be provided to all the prison workers as well as employees who are working in the prison. so that the unnecessary torturing should be avoided with the people with mental health disease. Provide information and education to prisoners and their families on mental health issues. Nurses and other healthcare providers should educate the families and patients about the mental health disorders and how to prevent them. Promote high standards in the prison management. Health hygiene needs like food, sanitation, promotion of the meaningful occupation should be encouraged among the people with incarcerated population. Ensure that the needs of prisoners are included in national mental health policies and plans. Policies and procedures should be developed to and included in providing care if someone fails to provide the proper treatment to the population. Promote adoption of mental health legislation that protects the human rights. The legislation should provide prisoners with mental disorders with procedural protections, also can help to promote the rights of prisoners, including a right to quality treatment, protection from torture, protection from violence and discrimination. Encourage intersectoral collaboration. By bringing ministries together, the problems can be solved effectively.
Hi, my name is Zina Pereira. So the next slide is prevention of violence in incarcerated groups. As per Center for Addiction and Mental Health, there is a higher risk of violence with one illness. For the people with mental health issues in incarcerated group, good services should be readily available, care planning and support, well-resourced, sensitive and responsive services, reduction in stigma, and policies of social inclusions, strong services, good housing and income support. Usage of drug can also be addressed to keep communities safer. Provide support with care if someone with a mental illness becomes involved in the criminal justice system. Correctional facility staff should be educated and provided training to help people with mental health issues. If the offender is minor and related to mental health problems, appropriate healthcare providers should be addressed. Court should refer forensic assessment to ensure whether it is due to mental health issue offense or criminal offense. Next is a screening tool for serious mental illness, SMI, in prison. It is a crucial component of prison mental health services. It is usually performed by a primary healthcare professional at the point of reception into the custody. The aim of screening tool is to detect persons likely to have an SMI, that is serious mental illness, who require more detailed mental health assessment. There are three major tools. The first one, the Brief Jail Mental Health Screen, which is BJMHS, comprises 8 questions, 6 symptom questions and 2 historical questions. It has been validated against a structured clinical interview for DSM-4. Next is the mental health screen of only 5 questions on past treatment and current criminal charges developed by Grubin in United Kingdom. The third one is the correctional mental health screen, which has a structure similar to that of the BJMHS but with 12 items. And these are our references.